a few small adjustments in the NCC also. I think one thing to say though is, although there's a feeling of Groundhog Day in some ways to this, because we feel we've been here before in March, the good thing is that we have learned how to do things, learned the hard way, I suppose, in terms of putting in place some of the safety measures and ways to continue to deliver care for people in the NCC, even with the restrictions in place. So I suppose that's on the positive side. Next slide, please. So I suppose the first thing to say is that we are still open. And so, you know, after the easing of restrictions in the summertime, we had maintained a good amount of our clinical service in the safe way that we had been used to delivering them, even when the restrictions were present. So in fact, we don't have to make too many changes now. In terms of your routine clinics, you'll notice that they've continued as telehealth clinic for the most part, either by phone or sometimes by video. And so, you know, there's no change there. That's continuing as normal. I suppose the one thing we had been a bit more permissive about in recent months had been seeing people in the centre face to face. And we have, I suppose, pulled back a little bit on face to face visits, which I'll show you in another slide in a minute. In terms of our day case treatments, like we've been continuing to book those by appointment based on people's clinical need. We want to make sure we don't have lots of people arriving all at the one time. We, I suppose, as we're looking forward now, are looking at our blood testing in particular. We want to try and reduce the numbers of blood tests we're doing, so we're trying to really only do those blood tests which are really needed and are going to change people's management. And there's a possibility of some outpatient phlebotomy, which I'll describe in a second also. And then for emergency treatments, the important advice is to call us in advance, because if we know you're on your way in, then we can make arrangements to make sure we can see you in a timely way and in the right place, the safest place for you. During working hours, we are going to have from next week HHUU back in action, which I'll show in a second. And out of hours is still going to be the emergency department though, because the HHUU will only be working hours, because we won't any longer have the ward nurses participating in the care in a HHUU. Next slide, please. So this is a little plan of the HHUU, and this is just to show, I suppose, some of the adjustments that have been made to the HHUU in recent weeks. So you'll remember before, the assessment unit on the H&H ward was part of the H&H ward itself. There was no kind of separation between the two. What we've now done is we've put up a set of doors, which are marked in red there in the middle of the drawing, a new set of doors which will separate the HHUU from the ward. And we've put a new entrance just before that interconnecting doors. So the entrance door for the HHUU has moved down a little. It used to be an office previously. In doing that, we've been able to add 2 additional treatment bays and 1 phlebotomy chair. As part of those refurbishments, we've also removed one of the patient toilets, not because we want to see people caught out, but actually it was being used as a storage room, because really we only needed 1 toilet in order to facilitate those folks who are using the HHUU. We've had some upgrades to the reception area also, but the reception area remains exactly where it was before. So the plan following this small refurbishment is that we'll reopen on Tuesday the 27th of October. And any people who've been booked in for day case treatments to the NCC up to now in the next few weeks, those people will be phoned in advance to let them know that there's a new location for their treatment. And we will be trying to, again, time people's visits very carefully, so that once we have somebody booked for a visit, we'll not have any waiting in the waiting area. We'll want to get them in on the time that they're scheduled, treat them, and then get them out in as safe and quick a way as we can. So I have a few photographs of the new refurbished area in HHUU now. So this is the reception area. As you'll see now, we have a door and a little Perspex panel there. So that'll just be to optimize people's safety, but Pamela will be still present to book people in. We have a new entrance, as I've mentioned, which has just moved a little bit closer to the lifts. And on the next picture there, you can see as you enter in, you'll see that this is the first of the new bays straight ahead of you. But towards the right there, you'll see these are the existing bays that were present previously. And moving on to the next slide. This is the view if you were standing at the end of the HHUU looking up. And again, you'll see the bays that were pre-existing there on the left, but a new nurses station there on the right. And these are just some of the existing cubicles that some people will be already familiar with. And then if you were in one of the existing cubicles looking across, you can see that's the second new treatment area, and on the left, the new phlebotomy bay. The idea of that little chair there is that people who are dropping in just for bloods don't need a whole bay, don't need to be on a trolley, and we can facilitate them in that phlebotomy chair. So just about those who are coming for face-to-face visits, these are the categories of people that we think we should prioritise for NCC. So the first category is anyone who, having had a telehealth review, the patient and the clinician feel it would be important to have an assessment. So we'll always be able to see those people. Anybody who rings up to say that they have symptoms such as anemia, shortness of breath, or unexpected bleeding, you know, we will absolutely want to see those people. Our patients who require regular clotting factor concentrate or transfusion, where we give that rather than them self-administering it, obviously all of those people will still be facilitated. For people switching to Haemophilia, we will only switch those who we've already put in place a plan to switch. These are often people who are now in the process of working through their home stocks of a lockdown. They have a date for switching. We're going to switch all of those people as planned. But for the moment, we won't switch any new people just until we maybe get a little bit of control over the numbers of cases in the community. We'll do intravenous iron supplementation only where we feel we have no other option. In other words, that people really can't take an oral treatment, and that treatment is very timely. In other words, we must give the treatment straight away. We'll do visits for bloods where the monitoring is really important, like, for example, someone who switched to Haemophilia 3 months ago, or someone who needs an inhibitor screen because they've had a first exposure to clotting factor concentrate. But things like routine inhibitor screens, we won't do a blood visit for those, and we'll just try and time those with the person's next face-to-face visit. We often do bloods for people who require check blood count or iron stores, and we'll be examining a few different options for those. For people who live far away from us at the moment, we've often been doing it with their local GP. It's a little bit more tricky to get the results up to us in the NCC, but it's certainly a very good option for people who live distant from us. Obviously, anybody who needs to attend the NCC for a review, we can do the bloods when we see them. And there are some new facilities being developed in the hospital which provide for outpatient phlebotomy. There's one express phlebotomy area, for example, near our laboratory in St. James's. And the idea there is that people can just pull up, go in for their booked, planned blood test, and then leave straight away without having to enter the main hospital. And we think that might work efficiently for those people who need to have a blood test, but who don't need to be actually seen and can be followed up with telehealth. So we're just in the middle of discussions about that, but I think that's looking like it could happen, and that might be a good option for some of our patients. For those who are on a vaccination program where you've already commenced a course, we'll complete that and we'll do the blood testing at the end of that course. But we won't be doing any routine virology checks other than for people who are currently on plasma-derived treatments. Next slide, please. In regards to the dental service, obviously all emergency dental treatment will be ongoing, but the dental team are going to revert to triaging through their teledentistry that they've gotten some experience of in the earlier part of the pandemic. Our second dental room has been used by the sickle cell service since HHUU was out of action. From next week, obviously, we'll always have a second dental room, so access to rooms won't be an issue. And at the moment, we feel that routine treatments like dental hygiene wouldn't be a good idea in level 5 restrictions, so we're going to call a halt to dental hygiene. But obviously, anybody who's deferred, we'll have a plan to reschedule. In terms of the allied health professionals that people might come into contact with, like our physiotherapists and our psychologists, they'll continue with their hybrid mix of face-to-face and telehealth according to the needs of the person. And there's no reduction in capacity. And equally, our medical social worker is available by telephone, and she continues to be available for everybody. So for them, really, it's business as usual, you know, in the sense of the last 7 months, things will continue just as they have been. Next slide, please. Now, there's been some discussion about the lack of access to H&H ward, and that's been felt very keenly by obviously people who access our services, but also by us as a team in trying to deliver care. So at the moment, the H&H ward is designated for people with suspected COVID-19 who obviously need single room isolation. there has been a meeting, as I'm sure Brian has communicated to the membership, with the CEO by the chair of the National Haemophilia Council, Brian, and myself last week. And she committed in that meeting that the H&H would revert to use for people with bleeding disorders once the pandemic subsided. So we'll just need to make sure that that happens in due course. But she also understood that there's a need for a base ward for people with bleeding disorders so that we can safely deliver care in the way that we've been used to since H&H ward opened. So I've just received some information in the last 24 hours that they have made moves to designate private 3 ward for elective procedures in people with bleeding disorders. So the Assistant Director of Nursing is in communication with Evelyn Singleton and our nursing team around training of ward nursing staff. I have a couple of follow-on questions for our Deputy CEO, and she has come back to me to say that she'll meet with me tomorrow. Specifically, those questions are if there's a further upsurge in patient numbers, what's the likelihood that that ward would be also required for COVID patients? And the second question is, if patients who are having elective procedures are going to private 3, what happens to people who are admitted acutely for treatment of bleeding? So I will try and get some update on those 2 questions when I am speaking to the Deputy CEO tomorrow. So that's a sort of a progress, a work in progress. The other side of it is the actual pathway for people who are admitted, especially for orthopedic surgeries, as this is probably one of our most common procedures. So we had a pathway that was working well a couple of years back, but unfortunately, through pressures that had to do with the theatre nursing and other staff, and also pressures on admissions in the last few years, even before the pandemic, it hadn't been working so well. And obviously, it's been really challenging since the pandemic. So the CEO at last week's meeting also agreed to convene a small cross-directorate working group. That means that it's going to include people from ourselves, surgery, admissions, theatres and anaesthetics, so that we can really reinstitute our previous approach to orthopaedic surgeries in particular. We did discuss, there's been some discussions about using capacity in the private hospital sector for things like elective or planned procedures to try and alleviate some of the pressure on the public system. I have discussed this with the CEO. I think at the moment, her feeling is that because of the complexity of this particular patient group, it would be best to try and keep it in St. James's at the moment, and I'd agree with that. But I have said that I'm very open to looking at other options if the public system is really going to be under pressure and it's not going to work. So again, that's under discussion still. In relation to forthcoming combined clinics, so we've a guide clinic coming up next week. The guide team are going to come to the NCC and they will see those people face to face in the NCC. If there are any blood tests that those folks need, we will do those during their visit, but we'll continue to manage their haemophilia care via telehealth so as to minimise the amount of time they have to spend in the centre and the number of people that people meet. In terms of orthopaedic clinics, which are held once a month, as people know, our physios do a great job of coordinating both our patients who are attending and our surgeons who are delivering the clinics. I know that previously there was a discussion between the orthopaedic surgeon and the physiotherapist as to which people would need to be seen face to face because they might need an examination, for example, or a scan or an x-ray, and then other people could be dealt with by telephone. So again, the physios will coordinate all of that. And then the other, I suppose, well, it's not a combined clinic, but it's a special clinic, and that's for young adults who are transitioning their care from the paediatric service to the NCC. We had made an effort over the summer months to see those young adults face to face, to allow them to meet the team and see the environment. But again, just at the moment, we think it's probably best that we try and do those telehealth unless for some clinical reason we need to see them. In relation to our open clinical trials, we have been able all through the pandemic to deliver all of our scheduled care for those patients, and we envisage that that will continue. At present, those clinical trial visits are scheduled and proceeding at face-to-face visits in the CRF. During the pandemic earlier on, the location of those visits was moved to the Trinity Centre. At the moment, there's no plan to do that. We're going to continue in CRF for now, but I will keep people posted if there's any change. In relation to clinical 2020, obviously, because we don't want to be doing the regular screening or repeated screening visits at the moment, we have a number of pending trials in 2021, and we are planning to get those trials really up and running and ready, so that when the time is safe and right to do it, that we'll be ready to move ahead. And I'll just mention that we have the Facetoface study, which is open in the Paediatric Centre, will be moving to the NCC in the early part of 2021. We will have a study on a factor VIII mimetic like emicizumab from Novo Nordisk. And we hope to have 2 gene therapy lead-in studies, one for factor VIII and one for factor IX. So those are the ones that are definitely going ahead in 2021. But when we might be able to see the first patient is still an open question. And again, I'll keep you all updated as time goes on. We have a couple of other studies also in discussions at the moment. It's a little bit preliminary to be talking about them right now, but again, I'll keep people posted as things progress. So our key message really is to keep in touch with us, so that if you have any concerns about bleeding or symptoms that you think need to be evaluated, or you're uncertain about any appointments you may have in the future, please contact us. Our nursing team, of course, are available during working hours. Our ANP, Niamh Larkin, is available for home treatment patients on her mobile number. I hope everyone has it, but it's up there on the screen if you need it. Obviously the out-of-hours service proceeds, but the instructions are to ring the main hospital switchboard and ask to speak to the haematology doctor on call, and that will get then transferred to the consultant on call, whichever one of us it happens to be. So that was really the main sort of updates I wanted to give, but I'm very happy to take any questions about the impact of the current restrictions on NCC.